done that I had people come up and say, who's the butcher that put in your stitches? Well, when they took them out, I couldn't raise my eyebrows. It was stuck, just like that. And I couldn't lower my eyebrows, couldn't raise them, couldn't change my facial expression from ear to ear. The only, and I was 19, I didn't know anything. I just knew that if I did this and pinched on my scar, not hard, but just kind of pulled on a little bit, that if I did that more than 5 minutes, it felt better. So 3 or 4 times a day, 15 to 20 minutes, I was just sitting there squeezing on that scar. And after about 3 months, I had full movement. Why? Because those tensions that I gave, and it wasn't hard. That's the idea. Scar work is not done hard. It can be really painful, but it's not hard. I lost my train of thought. So anyhow, by working on that, what I did was I pulled on the tissues for a long period of time. And see, fascia is really sturdy and doesn't like to stretch. But fascia is like Play-Doh. Anyone ever used Play-Doh before? Okay. Take it out of the can, you squeeze it, it's hard, right? You put it in your hand, hold it for a little while, it's soft. You know, like 5 minutes, open it up, and then it's very pliable. Fascia is the exact same way. You put it under a little tiny bit of stretch for about 5 minutes, and suddenly it's much more agreeable to move. So that's what I was doing. What I hadn't known about it is I was just putting it under a little stress, and then I'd move my eyebrows and stuff, and oh, things are moving. This is cool. If I do that, that actually gets things to I can raise my eyebrows, I can crinkle my forehead, I can do all sorts of fun things. Same thing with you. When you start to let the sustain the stretch and let the fascia stretch and start to break down, as it stretches, it will stretch one direction at one level and hold still in the other, and those cross bridges, like I talked about, from layer to layer to layer, they start to break down. And as they break down, you get your layers back. And as you get your layers back, you get your movement back. And it decreases your pain. Okay, so anyway, the biggest issue is, if you're going to work on family pain, is work on your scars. Make sure that there is no restriction. Make sure that you don't have a lot of puckering. Puckering of a scar is just it all stuck together nice and deep. And the deeper it is, the harder it is to break down. And when scar tissue is hard, it's not a thing of, okay, well, it's hard, so I'll work harder. Like I said, let me borrow now. See how hard I'm moving her skin? I moved some people with scar problems before that hard and put them in tears. Or you can really crank on some people, that's not a big deal. Thank you. It just depends. So the point is, it's not a thing of let's see how much pain we can cause, even though it can be really uncomfortable. But it is a soft, slow technique. And all it is a basic hold. Let's back you up a little. Let's see, where can we put you where people can see? Probably
Right on the table.
Okay, why don't you back up right there? Okay. Okay. I saw him twice, and he's been working on it. Basically, see this dent right here?
Mm-hmm.
That's a problem child. Because that tissue is stuck down in, and so when he goes to move, there's tension right away. See if I do this? See how but it locks in there and it doesn't come past?
Mm-hmm.
But if you do this here, see when I do that, it moves his whole leg way up here, even though I'm on the other side of the scar.
Mm-hmm.
Yeah.
That's what you want out of your scar. You want it to move. Okay? So what Charlie's been working on a lot is just basically putting a little pressure in some direction on his scar where he feels tension. That's all you gotta do. Is
How many times a day do you do that?
I told him not more than 100.
Oh, okay, so
Yeah.
Anytime I'm
constantly.
sitting there
No,
watching TV.
one time a day is better than none. 2 is better than 1.
When you think about it, you do it.
And if he's sitting around watching TV, he can do it. And then, an hour or two later, he can do it again if he wants, if he thinks about it and it's important to him.
The more I do it, the more I think about it,
Right.
okay, I'm just sitting here and I can.
And the more he does it, the more he gets stuff like this. See this? When I did this, it didn't look like it moved, but actually, with what he's been doing, what I did, this was a very deep spot. It was that deep, okay? But see, even that moves some now. And that's only after me seeing him twice, and you working on it for a week, right? Because I saw him last Monday, it was the first time I saw him.
Wow.
And I did this and another energy technique that, it's gonna be kinda hard to show you, but I can do it. But basically, it's a technique that I'll give you the physics of it. The physics of it is that, there's a rule in physics called right-hand rule. When you put electricity through a wire, if you follow the way the fingers of your right hand goes, that's where the outside magnetic field is, and electric fields are. And notice how I said outside? Well, your entire body is made up of wires called nerves, because all your nerve impulses are electricity. So that means by following that rule, that every nerve you have has to have a electric field, magnetic field outside of it. So if you've got nerves near the surface, that means your magnetic and electric fields are out here. So, and you can actually feel those when you've practiced a little bit, and you close your eyes and you can actually feel where those fields are. Now, the funny thing about this is usually it's only about this far off the skin. When I worked on Charlie, I had him lay flat, stick his legs out. Let me borrow this leg. Oh yeah. The field came out about here. That's where I felt it. Actually. Now, when this leg came up, that field came out to here, just like his leg was there. And even though his leg ends here, he had the same energy kind of signature on both legs. That's not ideal. He doesn't want that. That's way too much stuff going on. And so I really feel that can be involved with your phantom limb pain. And when we've done techniques to help with the management of the energy of the leg, now he's right there. So that's significantly better. It's not where we'd like it in here. So he's probably still got a little something going on. And you said that since last Monday you've had none of those sharp pains that bother you so much.
Call them zingers, where they suddenly just hit you and.
Do they go down to your leg?
Oh yeah.
How far down?
Far down in the foot.
Okay, and those zingers are gone. They've been gone for a week now. Me working on them twice and him working on them.
Just from massaging that scar
It's not massaging,
or pulling on it?
putting tension on it.
Tension, yeah.
Yeah. Because see, people think of massage and they do this. And they do this, and they do that, and all this sort of stuff. That's not gonna do it. You have to allow the soft tissue a chance, the fascia a chance to release. And the only way you can do that is give it a couple of minutes. So, anyway, what's happened now is, like I said, his energy signature is out to about here. He's got lots more movement. Relax your leg, pull your leg in that way. He can put his legs together. He couldn't do that before. That's all because his scar is being managed now. He's doing almost all the managing. And gradually, eventually, most of this puckering will disappear. Now, from a prosthetist point of view, when you have a limb that doesn't have any puckering, is that easier to manage?
Much. It is. When you have scarring, when you have invaginations, that becomes very difficult. And we teach exactly what you're saying. It's just pressure, kind of. It's not a massage. It's more of a deep tissue massage. Kind of pull, hold in the other direction, in every direction around that scar tissue. And those are your successes. Those are your patients that do very well. It's those